Hi everyone, thank you for tuning in to another episode of Holding Court with the Empress of West Hollywood. My name's Enoch Miller, your Empress, and we're really excited to have you today. We want to thank our sponsors for GayLifeLA.com as well as King Real Apartments for hosting us here today, being special, and they're amazing partners, and we're really grateful for them to put on the show every week. Also, we want to make sure everyone's staying safe for the fires that are going on right now here in the LA area. Be careful driving. They're shutting down a lot of the freeways, so just make sure you plan your routes accordingly and don't get burnt, because crispy ain't fun, ever. But we want to give a special thank you to these guys here from APLA Health. We have Carlos and Carlos, Mr. C squared. And so it's Carlos Mena, and then I'm going to butcher your last name, so could you say it for me, please?
Aguas Pinzon.
Aguas Pinzon.
Perfect.
Yes. Okay. Thank God for Spanish 101. So, guys, I think we're just going to go right into the beginning of what APLA is, APLA Health, because there's a difference between APLA and then APLA Health. So, Carlos, just give us a little bit about what APLA Health is and kind of what your guys' mission is for the organization.
Cool. So my name is Carlos D. Mena.
Okay.
I'm the enrollment specialist at APLA Health.
All right.
So I'm located in Long Beach, and some of the services that we provide, it's just a small portion of a lot of different resources that we have.
Okay.
So at APLA Health in Long Beach, we have dental services. We have primary care. We have behavioral health as well.
Oh, wow.
And it's really great just because we know the community needs these types of services. When it comes to HIV positive or HIV negative, these services are so necessary, and it's really good for primary care altogether.
Exactly. And then, Carlos, what for HIV care and also for preventative care, what are some of the different services you guys apply for APLA Health to individuals who are looking for that?
So, real quickly to backtrack just a bit, the distinction between APLA and APLA Health is merely administrative.
Okay.
Right? So we're all one big happy family.
Yes.
It's just for,
the
lines
technical.
and forms. Exactly. It's merely administrative. And so we have 3 clinics, and at one where we provide primary HIV care, we have an MCCT medical care coordination.
Okay.
And we have, at the psychosocial side where I'm out of, for Suppositive, I'm the coordinator of this program,
Right.
and we do all sorts of psychosocial programs and services to individuals who are living with HIV, but also those affected by it.
Right. And just for a lot of people who don't know, I'm just going to read their mission statement really quick because it's actually, it encompasses what they just said right now. APLA Health's mission is to achieve healthcare equality and promote well-being for the LGBT community and other underserved communities and people living or affected by HIV. So you guys really cover a lot, and I love the fact that what your organization is about is bringing coverage to underserved communities, which for our LA area is actually a really big community for obviously people of color, but also for other people living or affected by HIV. Let's go into some of the different things you guys do through support. Carlos, we'll start with you. Kind of what is the different stuff you guys utilize to help support someone through different services for for healthcare and different things like that?
So I am actually the enrollment specialist at APLA Health in Long Beach.
Okay.
So what I make sure is that everybody knows that they're able to get access at APLA.
Got it.
Regardless of background, regardless of who they are, or their, altogether, it just, some people qualify certain insurances, some people don't. For those who don't qualify for government or government or Covered California or Medi-Cal, they do qualify for still other programs.
Right.
So My Health LA is very important for those who are not who are undocumented.
Got it.
They could get services there also. So my job is just primarily to make sure whoever comes to our services or whoever comes to APLA can get those services at our place.
Right. And the great thing about what they do there as well, they have a whole staff there that are really dedicated to guiding you to what the best service or healthcare or insurance or whatever it is. They are really good about pointing you in the right directions, going, hey, this might not work for you, but I think this will be better.
Exactly.
And then you guys are really great on that. And then, this is Carlos.
And I've been paying really close attention to your...
But no, for Carlos, for what you guys, for HIV and preventative care services, what are a lot of stuff, because your biggest facility is it the Long Beach one is your bigger one, or is that Baldwin Hills is the bigger one?
So I think Baldwin Hills has more patients.
Got it.
Long Beach is a bit newer.
Got it. Oh, that's right. That's the newest one. Right.
The one that probably we've been at the longest is it's on Kingsley Drive around Koreatown.
Okay.
And that's where we provide basically all of the psychosocial services. That's where
you're at. So what are some of the different things you guys provide for HIV or people looking for preventative care as well?
So for preventative care, there's an entire prevention team.
Okay.
There are specific programs that address 18 to 24-year-olds.
Okay.
And, MSM of color.
Okay.
So they're looking at the numbers and seeing, where is the highest need.
And is that part of what Fuerza Positiva does?
To a certain degree,
okay.
yeah. We don't have an age bracket necessarily, but my program is, my number one job is to link individuals who are diagnosed with HIV, newly diagnosed, or who have not been in care for over 6 months.
Oh, wow.
And I try to re-engage them because
Gotcha.
there are these perceived barriers
right.
that individuals who, when you stated, if they're undocumented, they don't have access to these services.
Mm-hmm.
We, in kind of the field, we're looking for a very diplomatic term for this population, and what we realized was probably the least threatening to the population itself.
Right.
We understood is categorically ineligible, right? So they can't apply to specific programs, but administratively, somebody who does not have residency or citizenship is way easier to get into medical care.
Oh, wow.
And way
That's surprising.
easier.
We think it'd be actually harder, like twice as hard.
And this is what the population may not know.
Gotcha.
So I'm delivering the message and be like, you got this, I can help you. It's my job to make sure that you know this stuff so you can help yourself.
So you guys are altering the perception of what is really available and out there, and really making sure, like you said, of people that are not thinking they're available for some of these things, and saying, no, it's readily available and actually easier for you to kind of get this care taken care of. So let's go into some of the different things that you guys, so the organization as a whole is really great in what they do. I mean, again, we have so many great opportunities here in the greater Los Angeles area for places, not just, APLA Health is another big one, but there's so many others out there that offer where we have no excuse not to know our status, not to know where healthcare is available. What do you two see, and you can pick which goes first, but which of you, what are some of the biggest either misconceptions or the biggest issues you guys run into with people talking about either being taken care of with care or preventative care, anything with HIV or potentially HIV? What do you guys find are some of the biggest issues you run into with people of getting them around, hey, this is something you can do and here's something you can take care of?
Can I take this one? Okay, perfect. So piggybacking off of what Carlos just said earlier, so most people who are non-insured or who don't know if they qualify for anything like that,
Got it.
One of the biggest conceptions that we have, and when it comes to enrollment, is when you have insurance, it's really hard to see if we take that kind of insurance.
Okay.
If we work with that insurance or so, but if you have no insurance, and right now, as you know, Covered California is going to be happening, and open enrollment is happening until January 31st.
Exactly, and we'll be getting to that soon, so we'll
Yeah.
talk about that. Yeah, we'll get into all the details with that for sure here in a little bit.
And the thing is, if you don't have insurance, if you don't feel like you're eligible for insurance, come to APLA, because the biggest misconception about getting care or access to care is the simple fact that, am I eligible to do that?
Right.
If you have no health insurance, if you are and you qualify for it, or you feel like you do qualify for it, or just curious to qualify for it, come to APLA Health, because if you have no health insurance, it's like an easy sponge. It's your brand new sponge. We could just, we could dab a lot of different things on it, and then you just absorb it. And it's really great because with APLA Health, we work with you, and if you have no health insurance, we'll enroll you into a plan. We'll put you into what you could qualify for, and then you could get services at that point. So I guess a lot of people's misconceptions is that I don't qualify for this.
Yeah.
I don't think I could do this. APLA Health is not for me. But the thing is, as an enrollment specialist, if you don't have health insurance, you do qualify for it. You're the biggest candidate for APLA Health. And if you do have health insurance, we'll work with you.
Gotcha.
If you have any questions, come to APLA. We have enrollment specialists there.
Yeah.
We have people who could definitely give you the resources and education just to make sure. I want to know my status. I know my status, or I just need to get services, man.
Gotcha.
Can you guys help me out with this?
And I think that's the biggest problem. A lot of people, they're afraid to ask, and you really shouldn't be afraid to ask questions, especially with people that's their job is to know how they can help you. So it is I can see that being one of the biggest misconceptions. For maybe either the Latin community or the other communities of color, I can see them not understanding a lot of what's going on, especially if they're potentially undocumented and not knowing, hey, this is what's available. Carlos, what do you think you see the most from people you go talk to and say, hey, what, besides obviously not knowing if they even qualify, what do you see is there a fear misconception that comes out there? What do you see the most of from either from Puerta Positiva or from just you being out and about with these kind of groups of people?
So there's a large population of individuals who are on this journey to achieve citizenship.
Gotcha.
And in that journey, they're very aware of their consumption of services. And sometimes there's an apprehension to access those services because they don't want it to adversely affect or prolong that journey. And in most of these social services, it's absolutely not a question. And I can understand absolutely why somebody would have that misconception. And so then it's my job to let them know, I understand, but let me let you know that that's not the case. And this is all that's available to you. And I feel that often in non-English speaking populations, there's another degree of, inaccessibility because they may not know how to ask for questions. So I'm rather not know what questions to ask. How to ask them. So I'm bilingual. Let me be that little interpreter or translator for you.
Exactly, and that's I think really too. I mean, especially when it's the language barrier, because that is especially around here. That's a big. You're trying to explain something, and you don't feel like you're getting it able to explain it correctly, and then also not knowing what questions to ask. It's like, hey, actually, you shouldn't be asking me this. You should really be asking me this, and then this is the direction I should take you down. So I can totally see that as being a big thing. What would maybe be one or two things you guys have seen in the community that has really changed positively in a very drastic way that's within the last maybe 5 to 10 years regarding care and regarding stuff with people with HIV and preventative care? We'll start with you, Carlos. What do you think has been one of the biggest kind of shifts in this kind of industry?
So I've been working for the LGBT community for not that long. It's been about 5 years now. But one of the things that I've noticed a lot about, and especially coming from my own culture and background, the college student background, it's just that it's a lot of sex positivity. Sex positivity has been a new trend that's been happening where it's just know your status. It's fun to have sex. It's great to have sex. It's a passion. It's fire. It's great. But the thing is, you just got to know how to have it. You just got to be sure you know your status. You got to know your partner's status. So I think with this new trend that's happening, sex positivity is great. But here's where APLA comes into place. Where APLA is kind of just well, know your status with us. Get tested for free. If you need treatment, come to us. Testing is free, treatment is free, and if you need anything else, there's enrollment specialists. If you need primary care, we're there for that. So I think the biggest trend that I've noticed, at least from my my background and culture, has been sex positivity, but there's still knowledge behind. Okay, I know I'm having a lot of fun. And how am I gonna have safe fun?
She's having lots of fun. So much fun. So we'll have his information afterwards. You can get in contact with Carlos because
this one.
This one.
This Carlos.
But no, I can totally see that. And I mean, especially now, the LGBT community for sure is very much. I don't want to call back in the 60s and 70s when we were called us hippies, but I mean, it's very much that free love.
Exactly.
It's be happy with your sexuality, who you are,
and
your identity.
Wrong with
exactly.
That. APLA knows its community already.
Yeah.
It knows, there's some people who'd rather not, and there's some people who'd rather will, The thing is, APLA is very inclusive of everybody. Even though we're an LGBT tailored organization, we're not going to say no to anybody else who would want to seek services. So for those who are ineligible, this is where it's tú puedes venir aquí. You can come here. And the thing is, APLA is very diverse. So for those who I don't speak English, what do I do? Well, APLA is so diverse that it has different language speaking people behind it.
No, exactly. And that's what's so great about it is the fact that you guys, and that's what you want. You want a community that feels like no matter who, what, where, when, why, whatever color, you have someone you can come talk to and someone that's there and readily available. So let's switch over to kind of what a lot of people have been obviously hearing tons and tons of information about over the last few years is stuff to do with PrEP and PEP. It's become a really big hot topic in a lot of different parts of the community because, well, first of all, a lot of people don't even know what the difference is between the two. They've heard a lot more about PrEP and not a whole lot about what actual PEP is. And so I'd like for you guys to kind of help us with the background. We'll go over some different facts about it that I kind of looked up. The thing is, what's great about the internet age is we have information accessibility all time, every time, anywhere. So, I mean, be careful going on to like WebMD and all these places. Be careful doing that. But the information is out there if you know where to look, or just come to them and ask them and people like them that know what they're doing because this is their job. So let's go into some of the different things that what kind of stuff talks about. So for people that don't know, the first fact about PrEP is for people that are high at risk for potentially contracting HIV. Now, that doesn't always mean the people you're having sex with or the people you're partnered with are HIV positive or anything. It's just that you have a very, like you said, free, positive sexual love all out there, call him. So it's there for people that are just actively sexually active and just making sure that you're taking care of yourself for that. So, Carlos, yes, just explain a little bit about what PrEP is for anyone that might not be aware of it.
Just really quickly, I've gone to several trainings regarding all of this. I remember when the FDA approved that little blue pill for PrEP purposes. Like May 2014, I was at a training, and it was HIV specific, and the room was buzzing. And through several trainings that I've gotten for it and about it, I would say that PrEP is for anyone who believes they need it. Right. And when it was FDA approved, it was for MSM, sex workers, or the transgender population. Right.
It was anyone who was at like high at risk for being either contracting it or passing it along.
And so what I think that did is it unfortunately set this precedent where women were like, none of those are me.
Gotcha.
And I feel that we left some people behind.
Okay. And
we need to make this tool available to anybody who feels that they can get any use out of it.
Right.
So now, PrEP is an intervention, so it's actually three things. It's a pill, a little blue pill, Truvada 701 engraved on it. It's made by Gilead Sciences.
Right.
It's labs that you get. You have to make sure that one of the requirements is you're HIV negative.
Okay.
Right? So they do an HIV test before they ever write you a prescription.
Right.
I've gotten a couple of HIV diagnoses that way.
Okay.
You know what? I should probably get on PrEP. They get HIV tested before they started, and that's how they found out.
Gotcha.
And then that testing continues throughout to make sure that if you are foregoing condoms, and it's not recommended as part of the intervention, but some people do, and the science to a certain degree does back that up, we do STD testing.
Okay.
And then ultimately it's sexual counseling.
Right.
How are you doing? Are you taking care of yourself?
Right.
Are you in charge of your sexuality?
Gotcha.
Make the world your oyster.
Yeah.
Or whatever the phrase is.
Yeah, but I do like that you said that, because honestly the biggest thing that a lot of people, I feel, are misconceiving about all of this is PrEP is not a substitute for safe sex. It is not a substitute at all for doing whatever you want, whenever you want, however you want. There are 30 million other STDs out there. There's every other STD besides HIV that you can still contract, and some of them aren't necessarily like curable. I mean, they stick with you. They may go away, but they stick with you. So it's PrEP, and I think that's the biggest misconception and the biggest issue I've had with a lot of people. And they're like, "Oh, I'm taking my PrEP. I'm good to go. I can go free condom, no way, whatever, and just fuck without fear." Which really irritated me, that campaign. And it's really just one of those things that it's preventative as another tool.
Mm-hmm.
What do you see a lot of either young people or people in general that come in and basically have that conception of, oh, I'm taking my PrEP and I don't have to do anything else to protect myself?
Not necessarily the youth, but to a certain degree, people do feel that they now have that freedom.
Gotcha.
And PrEP has nothing to do with condom use.
No, it doesn't.
Right? Whether or not you're taking it, this is a way to protect yourself to another degree and level. And, HIV doesn't prevent pregnancy. It doesn't stop other STDs. Right. So, when you're at risk for all of this, when you're engaging in adult activities, you're clicking one box when you're taking that pill. So it's awesome because that's a box that is, kind of a big deal.
Right.
But to a certain degree, Genital warts are also a virus. Herpes are a virus. HPV, is something that affects women.
Syphilis and chlamydia can freaking fry your brain. I mean,
and so
seriously.
Right.
Yeah,
so at least they're bacterial, and I can give you antibiotics and you can be okay.
Right.
But with these other, because they're viruses, like welcome to a lifelong roommate.
Right.
Right. That you basically have to manage.
Right.
To cure.
Exactly. And I think that's the biggest thing is people do not pay attention to the fact that it's just like, it's not just this whole, I can do it, because again, and even PrEP, and they put this in there as well, it's not 100% effective. It is not, you take PrEP and you will never get HIV. It's going to severely lower your chances of getting it because you're making sure you're keeping it like under check, but I mean, condoms are not 100% effective. All these other things you take, nothing is ever 100%. So again, it's like you said, you're checking off one box. Granted, it's the A big box in the beginning, but it's everything else still follows after it, and you've really got to make sure that you do not substitute this for safe sex, which, regardless of who you are, always get tested, please. And then, like how you're saying, it does require supervision from a doctor,
right? Because
some people do have adverse reactions to it, because it can be on some people harsh to their systems, just because they either their body doesn't like it or whatever.
Right. So thankfully, this is a medication that's been around for a really long time.
Right.
So we have a lot of data on it.
Right.
We don't have a lot of data specifically for individuals who are HIV negative.
Right.
The purpose was it is part of the regimen, the cocktail.
Right.
Right. And if you're HIV positive, you wouldn't only just take this little blue pill. It's part of a regimen.
You take several others. Right. And I don't. A lot of people with HIV end up taking stuff like Triumec and there's an M1. I don't remember. It's one. But I mean, I know it's a bunch of different stuff that come in concert with all that as well.
Yeah, 2017, almost 2018. We have five pills.
5 pills, got it.
That are a 1 pill once a day regimen for
Gotcha.
HIV care, and it's comprehensive care. Triumec being one of them, Atripla, Gemvoya, Odefsey, and that's awesome. Truvada is a medication that HIV positive people can take as part of the regimen. We don't have a lot of data for how it affects HIV negative people, but we did studies, so far so good, and surprisingly, when it's used as PrEP, you're HIV negative, and I know that because I had a blood test, and then you take it, for whatever reason, let's say you find your soulmate, or you decide to become a nun, or you choose a path of abstinence, power to you. You stop taking PrEP, the intervention, medically, pill, and sexual counseling, and it flushes out of your system.
Okay.
And so what we want to make sure is that your kidneys and your liver are okay while you take it.
Oh yeah, because they process everything like that, no matter what pills you take.
Your liver being your filter, and then your kidney kind of processing for you to get rid of it. And when you stop PrEP, they go back to normal, totally legit functions.
Okay.
So, it is really convenient, and it is really empowering for people to feel that they have some sort of control back, at least when it comes to clicking that box.
Right.
So if you feel you need it, then let's have a conversation about it.
Right. No, and it's true. I mean, side effects are typically manageable. Everything has side effects. So let's go into the difference between what PrEP is and then what PEP is. Because I don't think a lot of people understand, because I've seen a lot of people actually starting to put it out there now where they're saying not just PrEP, it's PrEP and PEP, and they're starting to explain the two. But give us a little bit of a breakdown as to what PrEP is compared to PEP, and that's PEP.
PEP has been around a lot longer.
Okay.
And it was initially for individuals who were in the medical field and would get pricked by a needle during like emergent kind of unforeseen adversities to the job.
Gotcha.
And so this was an intervention, 28 days worth of medication.
Okay.
And even though you were exposed to HIV, you didn't acquire or were infected with HIV because you took these pills.
Got it.
It was
so it's like a blocker almost?
Yeah.
Okay.
Yeah.
So it's your morning after blocker.
Morning after blocker. And, I don't know how detailed you want me to get into.
I mean, just really just kind of what, so PEP's really, for mostly people that were in the medical fields, if they had this really random, because of their job interaction with it, and it was to help them immediately, just something that it's like a blocker right away, keep yourself protected, and then you should be fine kind of thing.
In general, if,
and then
we have questions.
PrEP is more an ongoing thing you take because you're sexually active and you feel like you would take it in order to make sure you protect yourself.
Yeah, and to make the distinction like really, really clear, these are acronyms.
Exactly.
And PEP is post, meaning after,
Sure, right.
exposure prophylaxis.
Right.
Prophylaxis is a word we, to prevent infection.
Right.
Prophylactic. I've heard people call condoms prophylactic.
Yeah.
Because they prevent infection,
Right.
HIV and other such.
And then PrEP is pre. Right.
Before. So, PEP, post-exposure, I got PrEP.
Right.
Now let me do something about it and take these 28 days worth
Right.
of pills. Pre is before I engage in these adult
Gotcha.
activities, let me make sure that I'm okay.
Gotcha.
So before I am exposed,
Gotcha.
let me use a prophylactic.
Awesome. All right. So that, and again, it's like again, I think a lot of people really don't pay attention to the differences of it all, and they're not actually doing all that fun stuff with really understanding what the science is between it all. So. Yeah, no, I'm just, the distinction didn't have to be super detailed, I know, but yeah, I was just wanting to make sure people understand it. So, and then I think the last, we already talked about how it's not the same. Okay, so let's get now into the meat and potatoes of all this and talk about Covered California and what their open enrollment is here for getting covered for services. So, Carlos, talk a little bit about what is going on right now for Covered California and what people should be really looking to do in order to make sure they have coverage.
So the thing is, it's very important to have coverage.
Right.
It's important because a lot of health disparities happen due to access.
Right.
So sometimes if you look at data, certain minority groups might be, at higher risk for getting HIV or AIDS or getting STDs or not getting services that when they need.
Right.
It's all due to access. So access is very important for the person to know. In order for someone to get all these services, they have to first know that they could get it.
Right.
Because it's kind of one of those huge question mark on top of your head where it's just like, can I get it? Can I not get it? Should I get it? It's like, well, now I know I could get it because I have my card here.
Gotcha.
So let me just go to the health center and let me just present to that.
Okay.
Before anybody can get that card or whatever, they have to enroll for it.
Okay.
So that's where I come into place.
Okay.
So right now it happened on November 1st all the way to January 31st.
Gotcha.
For open enrollment for Covered California.
Okay.
And it's very simple. All you have to do is just call us. Let us know what the situation is, whether you're eligible, whether you feel like you're eligible or not. We'll see what we could do. But it's very important just for everybody who's listening or watching, just to make sure is this for me? And more than often than not, it's yes.
Yeah.
The answer is always yes.
Okay.
APLA has a lot of different services. We're contracted with so many different insurance companies. We make sure that regardless who you are, what background you're coming from, you get that.
Good.
So access. It's going to be Covered California or just Medi-Cal or all these different services.
Okay.
You're able to qualify for it and register for it at APLA with enrollment specialists like myself, and there's many more others. Right there, we speak different languages.
Yeah.
We come from different backgrounds, as I said, and it's the only reason I say this is because diversity is power, and APLA knows it's very diverse in itself, whether it's communities, whether it's patients, whether it's its own staff.
Right.
So whoever wants to qualify for it or whoever wants to register for it could definitely come to APLA there.
So explain the difference to people that might not understand what Medi-Cal and Covered California, the differences between those, because it's not, it sounds like it's kind of the same thing, but it really isn't. It's kind of separate.
Exactly. So it just depends on how much they act financially wise.
Okay.
So the thing is, it's all based on finances.
Got it.
So it's very complicated, and the thing is, it's really up to individuals at this point.
Okay.
I could say John Joe could definitely qualify for Medi-Cal, but the other person's going to qualify for a Covered California as well, but it's just, everybody's very different. So I can't really give you a concrete answer of like, oh, you're definitely going to qualify for this.
So you don't know until you get into all the details of what their background is and everything with that.
And it's really simple. Most of the time, they could just give me a call, and then I could just kind of know right then and there.
Okay.
I don't know if you want to add anything to that.
So it is totally based on income.
Okay.
And then there are certain categories where you are automatic. So I think...
Oh. So you're automatic one or the other.
Mm-hmm. Right.
Got it.
And it's usually automatic Medi-Cal. This is for individuals who make less income.
Okay.
And at a certain point, you make too much money to have Medi-Cal, so it turns into Covered California.
Okay.
And then there's a bunch of plans there that you can choose from. And so individuals who are automatic Medi-Cal are usually like, blind individuals, people with categorical disability.
Got it.
AIDS used to be one of them, not so much anymore because people who are living with AIDS or HIV positive are going to die of old age, first of all.
Right.
But they live completely active full-time jobs, and they could be making a lot of money, so they don't, they are not covered by Medi-Cal.
Right.
Yeah.
So it's mostly for people. I know a lot of elderly fall into the Medi-Cal coverage. People that are fixed incomes, things like that. Like you said, I mean, people with disability. And so, so really it's basically Medi-Cal is for people that reach a certain point below the level of whatever that level is. And then Cover California is for anyone above that. Correct. And it just breaks up into different plans per those things. Okay, so for a lot of people who don't know what's going on there, so for Cover California, what's going on is open enrollment here, like you said, to the January 31st. The different parts of it are, so the key dates are enroll by December 15th to have coverage by January 1st. Cover California, which is the California's exchange, open enrollment ends January 31st, so that's the last time you can get to open enrollment part. And then the federal exchange open enrollment ends December 15th. So let's hit each one of those and you can kind of explain the differences. So the enroll by December 15th to have coverage by January 1st. That means you just enroll for either Cover California or Medi-Cal, and then you're able to have that before the 15th by the 1st.
Yes.
Okay. And then what's the difference between the California Exchange open enrollment ending the 31st? Is that still the same thing for Cover California?
It should be. I understand.
You stated that there was a difference between the 15th and the
31st. Yeah, the federal exchange open enrollment ends December 15th.
Right. So, if I understand it correctly, and he's an enrollment specialist, so he'll probably know better than me. And please feel free. You can get into.
Do you want me to do this?
Sure, please.
So this is Alex. Alex is the Director of Communications here at APLA Health.
Okay.
And so he's going to let us know what
All right. So the December 15th deadline is to sort of have your coverage start on January 1. That means that you have coverage January 1 through Cover California, whether you got a Kaiser plan, an Anthem plan, a Blue Shield plan, doesn't matter. You'll have coverage January 1 provided you make your first premium payment. That sort of gets around the individual mandate, which everyone's talking about. And I'm not going to get into a policy debate right now. But if you wait until Cover California goes till January 31st, then your coverage doesn't start till the next month, February. Or March, depending on when you enroll in January. So if you live in California, you enroll through Cover California. Cover California and about 13 other states extended our open enrollment to January 31st, as had been every other year. Now, other states like Kansas, where I'm from, they rely solely on the federal exchange, which ends on December 15th.
Okay.
So anybody in Kansas can enroll through Cover California. However, if you live in Los Angeles County, you are able to enroll till January 31st.
Got it. All right.
And then again, Medi-Cal is all year round.
Yeah, Medi-Cal, that's a whole nother beast with that. So that was our surprise walk-on from our Director of Communications there at APLA Health.
Thank you, Alex.
Alex Medina. And then a couple of things you can do. We'll put this in the description as well, but we'll put in the phone numbers you guys can reach at them. There's the Chen Health Center in Baldwin Hills, and also the new one, which is the Long Beach Health Center as well. We'll put the information there for where you can call those numbers as well too. So going into what this is, so what does this option for Cover California give people? What are the different things they have now that they're available to have access to?
A full scope of it's a full scope of spectrum right there that they're able to get.
So it's just basically everything that if they're enrolled, they can get any type of service, or is it
primary
specific?
care? Right there, they're going to be able to get primary care, which is the most important part right there.
Okay.
So they're able to get labs. They're able to get all these different types of testings and stuff at no cost whatsoever. So it's very important just because of that, where it's at access.
Gotcha.
So access is very important for that. So in order for them to qualify all these different things, it just depends on effective dates.
Okay.
So, if your effective date is January 1st or, February 1st, that's when we can start doing more labs with you.
Gotcha.
That's where the intervention comes into place. That's where all these different things come into place at APLA for the individual at that point on.
Okay, because then that way they have the coverage, then they can start getting everything taken care of on the back end. When a person comes into your office and is looking to enroll, what kind of steps or things that you ask them to have readily available for you, so that way you can just go smoothly for the process? Perfect. What are kind of the main things that you expect from a client as they are going to be able to, they're in your office with you, being able to go from A to Z complete their enrollment, and then be ready to move forward?
So at APLA, we have a couple of different programs in order for people to get services.
Okay.
We have, depending on if you have insurance,
Gotcha.
if you don't have insurance, and we have sliding scale for them.
Okay.
So basically I call, whoever it is, let's say for example, Jane Doe calls me.
Yeah.
And she asks, hey, I want to get services at your place. What do I qualify for?
Gotcha.
And I ask her, like, well, Jane, what do you have? Do you have insurance? No, I don't.
Okay.
Okay, perfect. Well, let's put you into a plan. Let's see what we can do together. I usually ask for an ID.
Okay.
2 latest checks.
Okay.
For financial purposes to see where they qualify in the spectrum of eligibility.
Okay.
And then on top of that, I ask for a utility bill as well, with their name and their address.
So really, it's ID, your last 2 pay stubs,
yes.
and then like a utility bill of whatever
exactly.
kind. Okay.
And the thing is, some people don't actually have pay stubs.
Okay.
So we do an affidavit.
Okay.
An affidavit basically says, I don't work, or I do work, or I get paid under the table, or whatever the situation may be, just to kind of have it on paper, just what their financial situation
Got it.
is.
Whatever it is, as either monthly or yearly or however they calculate.
Exactly.
It. Okay.
Mm-hmm.
And then so you get all that information. Then you find out, and from that point, then that's how you find out what they're qualified for.
Exactly, yeah.
Okay.
So we have, I basically work together with them.
Okay.
I see what they qualify for. I work with them at the application together.
Okay.
So whether it's covered
So you guys go
California.
through the entire application
Exactly,
together.
yeah.
Okay.
And what's really fun about APLA, I love what I do.
Mm-hmm.
So sometimes I like to put a little music on because I know it sometimes takes a long time for
Well,
me to
those
review.
applications can be like a long ass
It might be a little while.
Yeah.
So let me just, work together with you.
Okay.
And for you won't, I don't know how to fill this part out. Well, let me just jump in at this point on
Okay.
with you.
Awesome. And I mean, that's the thing is, like, again, remember the biggest thing is do not be afraid to ask questions. Do not be afraid to go, hey, like, I don't know what I need to do. Can you help explain it to me?
Mm-hmm.
The great thing about it is they know what they're doing. The rest of us do not. And this stuff can be really complicated because you never know, again, based on this, that, or the other. There's so many different things that will switch. Well, just because you have this means now you get this and blah, blah.
Mm-hmm.
So for someone coming in, then they go and then you walk them through the part. They get their application filled out. How long does that take to process or for them to be actually, okay, I'm done, I have my card,
Perfect.
I'm ready to go?
So let's stick with the Doe family.
Okay.
Now, okay. So Jane Doe, she said she has no eligibility.
She's a bitch. She's, she's like complicated. I got a complicated order right here.
So
okay.
she's like, I gotta sign up for it and everything.
Got it.
Perfect.
Okay.
So I work together with that person.
Gotcha.
We work on the application together, but that's just gonna be for that kind of application.
Got it.
Let's say, for example, her brother John Doe.
Okay.
He has the full spectrum, full on Medi-Cal.
Okay.
So we could just, I call insurance company. I'll let them know, hey, I have John Doe with me.
Uh-huh.
He would like to change his plan, or he would like to change his primary care provider.
Got it.
If he or she or they want to get all these different types of services,
Like what you did.
if they want to get that kind of service, they could definitely get that.
Okay.
And it's not like I said, it's not a one size fits all.
Right. Right.
Some insurance companies might say, effective date, December 1st. Some other insurances might say January 1st.
Okay.
It's just depends on the type of insurance or the type of eligibility that they have.
Is there ever consistency in it being like 30 days or something like that?
Yeah.
Okay.
So let's say, for example, right now we're in December.
Got
It's
it.
what, December 5th? 6th?
6th. 5th.
So, 6th.
6th. It's a day on the beginning of January.
So.
Sometime because it's the beginning of the day symptom. Okay, so.
But, I mean, some insurance companies would actually say, this is our patient.
Okay.
We'll make it December 1st.
Gotcha.
That's on a really good, oh my God.
That's like everything works.
Exactly. But to some insurances, it might be until the next month.
Okay.
But the thing is, patients have to be their own advocate. If they need, if they know they need labs,
Okay.
if they know they need, services now, the insurance companies will hear that.
Got it.
And they'll make exceptions for that.
Okay.
So it's just, and I usually try to make sure, when I hear my patient situations, whether it's a great one or a good one, I try to make sure be your own advocate.
Okay.
Because I would love for you to come getting services here and now at APLA.
Yeah, and that's what's hard too. It's like a lot of people don't realize you've got to call and be on especially the insurance companies. You've got to be on their butts about.
But here's the
paying
thing:
attention.
as enrollment specialist, I'm the one who has to be on that phone call with that.
Well, right.
So that's where I put the hold music on for them also. So if you ever come to the Long Beach Health office, there's always 80s music ready for you. A little Shrew by, Spandau Ballet right there. Just having good music right there. I love 80s music. I'm sorry,
I love the fact that he's not old enough to know what that is because he wasn't even born then.
I love it, but it's like, at least we're like, I'm on the phone with insurance company. They're jamming out. It's just like, it's that whole holistic feel that I want to make sure that APLA patients get that.
Okay.
As soon as they want, before they even see the provider, they have to see the enrollment specialist sometimes. I'm that person. I want to make sure that the person, whoever it is, gets to feel home. They get to feel like, okay, this place is pretty cool.
Yeah.
Carlos is jamming out to the whole music while I'm jamming out to my own 80s music right here.
Gotcha. And so they've gone through, you kind of figure out where they fall in the line of spectrum of services and everything like that. How often do they need to come back and check in with you, or do you just kind of follow up with them every now and then on stuff?
I follow them with them every now and then.
Okay.
I give them my card. I make sure, and I like to repeat my name so many times just because it's one of those, like, if you ever have any questions, let me know.
Right.
If you have any concerns, let me know.
Right.
If you have anything, questions, concerns, comments, let me know. I'll be the first person to want to make sure that I make it right.
Okay, great. And like you said, people pay attention. We'll put this in the description as well, but also make sure it is going to be for December 15th. That way you can get it by January 1, but it's through January 31st that it is available. So, but just get it done right now, because when it's done, it's done, and you have it done by January, and you're good. So, is there anything you guys would want to point out or make sure anyone remembers specifically about Covered California or about anything to do with preventative care that really says, hey, get this done now, make sure you take care of this now, so that way you're setting your future right on the right track? We'll go with you first, Carlos.
So I think I'm just going to say, access with a capital A.
Okay.
Everybody's eligible to get it.
Got it.
Everybody's eligible to get healthcare services. Whether, you are old, young, black, white, anything, you can get all these different services here at APLA.
Awesome.
We're very diverse. We're very educated. We make sure we have a lot of resources with us to make sure that the community knows what we have to serve for them. Because, altogether, just as I see a police officer just doing its duty out there, my duty is at APLA making sure that the community knows about our services, and I'm making sure that, hey, there's Carlos. I see Carlos on on everything, on social media. He knows what's up about APLA. So come to APLA. Access is definitely key to success.
Awesome. All right, and Carlos, you?
When it comes to prevention, I would tell people, love yourself enough to owe your temple of a body that much, knowledge, awareness, empowerment. The more prepared you are with anything in life, the better, safer, more successful it will be. So, get educated, take care of yourself. By taking care of yourself, you take care of others as well. Public health, you owe it to yourself.
And if you can't love yourself, how the hell can you love anyone else? Thank you, Mama Ru. But I really thank you guys for being here today. You guys have been so great. And, seriously, people, ask someone. If you don't know or you don't think you know, or screw WebMD, any of these things, really just ask a person that is their job. This is what they do on a daily basis to make sure we, as LGBT and beyond individuals, stay safe, healthy, and secure in our lives here, because we have no excuse in this community to not have access to all these amazing services. And like I said, we'll put the information for you guys to get in contact with the offices over in Baldwin Hills as well as in Long Beach. And really just check it out online. Go to APLAhealth.org, and you can find out all their services there as well. We also want to thank especially GayLifeLA.com and also Kings Road Apartments for letting us be here today. We really appreciate everything they do for us. And we'll check you guys out next week, where we have Sean Augustine, who's our amazing local musician. So he's going to have a lot of fun talking with him about what he does and all his nightlife shenanigans. So thank you guys so much. We'll talk to you soon. Bye.